patient's mom.
Ready. Come in.
Hello, my name's Monica and I'll be your student nurse. Let me just shut the door for some privacy. I'm going to wash my hands.
Okay.
I'm going to shut the curtain for more privacy.
Mm-hmm.
Can you tell me your name, please?
Yeah, Amanda Seltzer.
And your date of birth.
8/29/95.
Okay, patient looks stated age. And now I'm going to ask you why we're here today.
Because I'm getting a head-to-toe assessment.
Okay, where are we?
University of Detroit Mercy.
And can you tell me what year it is?
2016.
Okay, patient is alert and oriented ×4. And posture looks erect. Mood is appropriate for the situation. And speech is clear and appropriate. And is it okay if I perform a head to toe for you?
Yes.
Okay. Is it okay if I touch your head?
Yes.
Alright. Head feels proportional to body. No signs of lesions or lumps. No signs of any lice. Alright. And now I'm going to check your eyes.
Alright.
Alright, will you look straight at me?
Mm-hmm.
Okay, and then look at the pen for me.
Mm-hmm.
Alright. Pupil size is equal, about a 3. And pupils are equal, round, reactant to light and accommodation. And now I'm going to check your mouth. Will you open your mouth for me? Okay. Let me look at your gums. They're pink and moist. Let me check your teeth. No cavities, no missing teeth. And stick out your tongue for me. Say ah. Uvula retracts appropriate in its midline. Okay, and then I'm going to check one more thing on your eyes, your conjunctiva. And it looks pink and no sign of infection or irritation. And let me see your tonsils. Okay, your tonsils are a 1+.
My mouth's gonna dry.
Okay, and now I'm going to check your carotid artery. Will you hold your breath for me? And then I'm going to check one at a time. Alright, and I will grade that a 2+ strong, and it's equal bilaterally. And now I'm going to listen with my bell, so I can listen for any bruits. And for my bell, I just press harder. Hold your breath for me. Okay. Other side. Okay. Sounds clear and no signs of bruits. And now I'm going to check your upper extremities.
Okay.
So will you hold out your arms for me? Alright, and temperature is warm, dry, color of skin looks appropriate for ethnicity, hair is equal throughout, and now I'm going to check your capillary refill. They're all less than 3 seconds. And then I'm going to check your nails, no clubbing. And now I'm going to have you squeeze my fingers to test your strength. Strength is equal, bilateral, and strong. And now I'm going to listen to your heart. Actually, before I listen to your heart, I'm going to check your brachial pulse. Alright. That is strong, a 2+ bilaterally. And now I'm going to check your radial pulse, which is strong as well, 2+ bilaterally and equal. And now I'm going to check your heart. Listen to your heart. Alright, I'm going to start at the aortic, which is the second intercostal space, right sternal border, and the pulmonic, which is the second intercostal space, left sternal border. And then I'm going to go to the herbs, which is the third intercostal space, left sternal border. And then the tricuspid, which is the fourth intercostal space, left sternal border. And the mitral, which is the fifth intercostal space, mid-clavicular line. And here I'm going to hold for 60 seconds for the apical rate. Alright. And then I'm going to press harder for my bell and return the same way. And heart rhythm is strong in a appropriate rhythm. And now I'm going to check for your lung sounds in 10 different places. Should be good. Alright, take a deep breath for me. And now I'm going to check your lateral anterior. And now I'm going to have you take deep breaths again, and I'm going to check your posterior side. And your posterior lateral sounds. Alright, interior lung sounds are all clear, posterior as well. And now I'm going to have you bend over. There was no signs of adventitious breath sounds. I'm going to check your spine. Feel straight and no abnormal curvatures. Now I'm going to check your CV angle if you'll sit up for me. Do you feel any tenderness when I do that? Any tenderness?
No.
Okay. And now I'm going to check your anterior-posterior ratio, which is a 2-to-1, no barrel chesting. And then I'm going to have you lay down for me and inspect your abdomen. Pull up your shirt. Okay. That contour is the contour is flat. I'm sorry. Contour is flat, and then I'm going to look at your skin. It doesn't look like any lesions, masses, bumps. I see there's a piercing, no redness or sign of infection, swelling, and it appears not too dry, moist, and pink. And then I'm going to listen to all 4 quadrants. I'm going to start with the right lower quadrant, which we have the right ovary, the right ureter, and the cecum. And then I'm going to listen to the left upper quadrant, which the right upper quadrant, which has the right liver, the gallbladder, the right kidney, the gallbladder, the gallbladder, and the liver. And then I'm going to check the left upper quadrant, which has the stomach, spleen, and pancreas. And then I'm going to listen to the left lower quadrant, which has the left ovary, left ureter, and the descending colon, part of the descending colon. And all quadrants have hyperactive vowel sounds present. Now I'm going to percuss. And noted sounds of timpani in all 4 quadrants. And now I'm going to lightly palpate. Do you feel any tenderness?
Nope.
Still no tenderness?
Mm-mm.
No tenderness and no lumps or masses felt. And now I'm going to pull down your shirt and have you sit up.
Okay.
And as you do that, I'm checking your veins for JVD. no JVD present. And now I'm going to check your lower extremities.
Okay.
First, I'm going to feel the temperature, which is appropriate. And your skin is warm, an appropriate color for your ethnicity. I don't see any swelling or feel any edema. And now I'm going to check your capillary refill on your toes, which are less than 3 seconds, which is good, which is appropriate. And then I'm going to check your popliteal, which I grade as a 2+ bilaterally nice and strong. And then your posterior tibial, which are 2+ bilateral. And then I'm going to check your dorsalis pedis, which are a 2+ bilateral as well. And then I'm going to check the Babinski test, which is I'm gonna take a blunt object and start at the heel and go up. And I'm looking for any flaring of the toes, which did not occur, which means she is negative for the test, which is what we want. Okay? And then I'm going to have you do the get up and go test. So you're going to get up from me and walk. And while you do this, I'm going to observe your gait, which is steady. Do you feel any dizziness?
No.
Okay. And then I'm going to have you do the Ronberg test, where you just stand here with your hands at your side. Close your eyes for me for 20 seconds. And I'm going to stay close just in case you fall. Okay, 20 seconds. And you didn't fall. There's a little swing, but that's normal. And you're good to go. Healthy.
Thank you.